My mother is 91 years old. She was unable to take care of herself, and she did not want to go to a nursing home. I promised her that I would respect and honor her decision.
I'm Wanda Drumgold. I'm 80 years old. My care was okay, but it was just that the doctor was rushed, spent like maybe 2 minutes with me. If I had questions, he couldn't answer my questions. I know my body better than the doctor knows my body, and he needs to hear about it.
In my private practice, I was seeing many older patients who had complicated needs, and I wasn't quite sure how to best handle them.
An older patient isn't just like everybody else.
They're all going to have their unique needs and beliefs.
They don't present in the same way as a younger person does. Something as simple as a urinary tract infection. You know, a younger person may say, oh, I have symptoms, I'm burning, I have to go to the bathroom more frequently. An older person may be confused.
They might have memory deficits, especially short-term memory deficits. They might have dementia, they might have Alzheimer's.
What makes a geriatrician different is that we feel comfortable dealing with that complex patient.
You just can't look at one piece of them because one medical problem affects everything else.
There are drug-drug interactions, drug-disease interactions.
Their function affects their medical problems affects their function.
Older people can easily become depressed, or they don't know how to access the kind of mental health care that they need.
And so it's not simply a matter of implementing what the science says is right. As a geriatrician, it's also about what are the potential side effects.
They're going to look at the whole picture, they'll prioritize, and they'll try to make a plan that would make the most sense for keeping you functioning and happy and comfortable.
And that takes sort of the special training to kind of understand that.
You learn how much you don't know.
I was fortunate enough to actually see how a geriatric assessment is done. They're looking at the person's function. Can they get up out of the chair? Can they walk across the room? Can they walk down the corridor?
I really love going out to the people's homes to see how they live. I do a specific geriatric nursing assessment, and I look at their environment, and I look at, who they're living with and what services they have. And I like getting all of those pieces and then kind of putting it all together.
They look around the home, they give you suggestions.
Well, I like her, coming to the house. It means I don't have to go out. It's very convenient, yeah.
To give her a bath, it was getting a little bit difficult. So we now have a seat that I can put right in the tub so that she can sit down. The toilet seat, we have a little handrail so that she can hold on to help her. And that really helped me.
It's more of a conversation in their home. We get to see how they live and how they move around their home and what are they really eating and how is that affecting their diabetes or their heart disease. It provides us with more opportunities for teaching.
Even though I am a trained health professional, there is still a lot to learn about geriatrics. It really is a separate entity on its own.
I worked 25 years. It never occurred to me that you could load up a cart or a box and take some of your stuff on the road, which is what we're doing.
You can't just be one person taking care of the older patient. It really does take an interdisciplinary team.
The best care comes when different people from different disciplines engage in collaborative conversations together to develop a comprehensive care plan.
There might be a PT, OT, VNA nurse, and nutritionist. We're all working together.
And I have all of them share all my findings with my doctor.
As a home care companion, I go into seniors' homes and spend the day with them, reading, going for walks, engaging in conversation. I try to engage the senior in a lot of activities that make them feel important, that gives meaning to their life, that doesn't make them feel so isolated.
Part of what I do as a social worker is to help people participate in their life by helping them connect to the world, help them connect to the community that they're living in, connecting them to the senior center or ongoing education for older adults in their community. It's helping them get the transportation they need so that they can actually go out and do the things that they want to do. It's helping them get the services in home so that they can stay there safely. And when people are well supported in the community, that's when they thrive.
It's able to give her a much better quality of life, and I know that she's happier.
They do treat you as a whole person.
They're very nice. I like everything that they do.
What do we want for our parents? What do we want for our grandparents? I think that's the question that all people need to ask, whether that be policymakers or physicians or the general public.
All doctors need to be inclusive with geriatrics because we are living longer.
You want their care team to understand some of the issues that come up as people age. Not just the medical concerns, but the functional concerns.
When I work with an older person, I also want to make sure I'm also working with the caregiver, because caregivers need to be educated, they need to be given support, they need to have the opportunity for respite, to take care of themselves, both emotionally and physically.
Some people, they don't understand, what exactly is out there that could help and support them and make things a little bit easier.
You want that team to have a nurse. You want that team to have a social worker. You want that team to actually coordinate care across many different subspecialties in medicine and surgery.
I wish this kind of care on anybody, any family member of mine, any person that I know. I wish that they could get this.